Hi, welcome to my YouTube video on treatment planning when working with those with addictive behaviors. This population is at risk for great harm, but we as clinicians have an opportunity when it comes to preventable causes of death in terms of different types of diseases to modify behavior or reduce risk factors. We have a potential to make a significant impact during the course of treatment. The disease model of addiction, we know then is a progressive and fatal disease. And there are other significant consequences as well, such as loss of employment, divorce, criminal activity, etc. For providers, the two most important parts of the entire process are the assessment and treatment planning piece. As practicing clinicians, we need to be experts in evidence-based assessment and treatment. It's important to stay current with best practices in the addictions field as new research is happening all the time. So simply stated, this is our case conceptualization process, right? We're assessing where clients are. We want to find out, where they're at in their disease process and where do they want to be, and then how do we help them get there. We know that the old school way of confronting this population is not effective, and so the therapeutic relation piece is critical. To do this successfully, you have to understand the process people go through prior to seeking treatment, such as working through denial, contemplating making changes, they're weighing the pros and cons, and people are experiencing moments of clarity throughout this process. Maybe they've had a third DUI, or they're starting to have health problems, or they lost their job. Clients often experience deep despair prior to seeking treatment, and we know that the stages of change process is not linear. It can even be fluid in the course of a day. Many people suffering from substance use will wake up in the morning with very strong resolve. I'm done. I'm never doing this again. Make plans, dump out any remaining alcohol. And then, so you may, as a clinician, do an assessment with a client in the morning, and your impression is that they are, all in. They're ready to make changes. They're excited about whatever treatment plan ideas that you come up with. And then somewhere during the course of the day, there's a shift, and the disease starts saying to a person, one more night won't hurt, I'll start the next day, I really don't have a problem, I can control my drinking. And so clients often find themselves baffled as to how they find themselves doing again what they vowed earlier that very same day to not do again. An appropriate intervention with evidence-based treatment is going to come from a skillful assessment, which can help in determining appropriate level of care. And addiction is a multidimensional and complex process involving a variety of factors. And so during assessment, you need to be aware of all of the different dimensions and things that you're looking at, not just type of use, amount, length of time, et cetera, but what kind of consequences has this person experienced? What are their internal resources, their coping abilities, their external resources? Are there other co-occurring mental health issues? Those are just some examples. And treatment planning needs to be individualized, and we know that the treatment planning process is collaborative. So part of the the assessment process often is preceded with a screening. And there are all different types of screening and assessment tools available. So it's really important that you understand what a particular tool is trying to capture. For example, is the idea early or prevention, so catching someone who may have risk factors for developing an addictive disease, or is it early intervention? So we've identified someone in active addiction, and it's time to do an assessment, a formal assessment to initiate services. From a prevention standpoint, with a positive screen, it's an opportunity to provide psychoeducation about risk factors and the process of how addiction can develop over time, as well as potential consequences. The goal is kind of increasing awareness and try to elicit an interest in change in terms of problematic behaviors, or thinking about just prevention before a disease progresses. Screening tool, again, if we identify someone in active addiction, the next step is formal assessment. And we know that there are different types of clinical interviews. Assessments need to be appropriately timed. So if someone still has substances in their system, then that is not a good time to do an assessment. And we also want to collect information from outside sources, such family, and we can also collect biological measures, such as hair samples. We want to attend to the whole person and be systemic in our thinking. Individuals interact with multiple systems. So in terms of understanding the extent of the problem, nature, scope, severity, with frequency and patterns, so we want to be comprehensive and concise, but it's also important to know the environment that a client is coming from. This is part of the relapse risk prevention. So we know if someone is living in a home where there is another person using substances, they may be at higher risk for relapse. Or we also want to understand social norms related to groups or circles that this person is in on a regular basis. So understanding a client's anticipated effects, so this is the motivation that keeps them or draws them to using, so maybe it helps them to interact socially or it numbs negative emotions. We want to understand how that related to the development as well as the maintenance of addictive behavior use. We sometimes hear people say in recovery, at first the substance was my solution. It was helping me to deal with problems that before I couldn't cope with. But then over time, it starts to come with lots of negative consequences, and so it doesn't have the same effect. And then the anticipated effects is this relation to pull and all sorts of triggers, right? So someone can be triggered and because of a smell or a situation or a thought, and there's a pull then to the addictive behavior. And because of that history of anticipated effects, they're seeking to reconnect with whatever that initial motivation was. It's also important to understand each person's negative effects or deterrents, right? So someone might say, well, I don't want to feel sick all day the next day after using substances, or I don't want to lose my family or lose my job. I don't want to feel in despair. I don't want to feel out of control. All kinds of different things. And that also helps with working with someone to plan for relapse prevention. Addiction is a long-term disease management. Understanding one's handling of those negative emotions, their direct or indirect social pressures, their current coping skills, their self-efficacy related to relapse. So if they've had a series of relapses already, they've likely lost confidence in their ability to battle their addiction. So it's important to include this in the assessment and the treatment plan so you can tailor your interventions to work towards preventing relapse, specific to each individual client's needs. So thinking about emotional, behavioral, environmental aspects. So for example, part of the treatment plan could be to role play with the client how to manage high risk situations that they may find themselves in that would be a potential for relapse. So assessment process, this is a review from things we've talked about earlier this semester, but all throughout the assessment process, we're kind of assessing or thinking to ourselves, is treatment indicated? What kind of treatment? How long should it be? Or how long will it take? And what's the general level or intensity of the emotional distress? And again, that can be different at different time points for clients. And then what's the prognosis for positive change? That assists us in developing our treatment plan and monitoring progress as we update the treatment plan throughout the course of treatment. So to kind of summarize that, we know something's wrong, we have an idea of its nature, we believe something can be done about what's wrong, and we have means for intervening that we think will be effective. and we have to plan for guiding the treatment, and we have a plan for guiding the treatment process. So in terms of just some considerations, level of care. So a client may not be successful if placed in a lower level of care than needed due to the severity of their addiction. If they're in a higher level of care, they may be successful, but it's not a good use of resources. Not all levels of care are available in all areas. For example, a lot of cities struggle to provide treatment for adolescents struggling with addiction. And so oftentimes you can do an assessment and determine that an intensive level of care is needed, but there aren't any treatment options available to meet the needs of that client. So in terms of treatment planning and assessment, we know that diagnosis is important. Again, it's also important to identify any other mental health issues, and then look to best practice for doing dual diagnosis treatment. There are other domains, interpersonal issues, coping skills, the ability to deal effectively with these issues. So, and then we know that all competent clinicians have a theoretical orientation and have evidence-based interventions that are population specific and ready to use based on the individual needs of the client. There was a time when the addictions field was trying to match personality traits or characteristics, or like maybe even patients with higher levels of self-efficacy or motivation to a specific treatment modality. Or other dimensions of like therapeutic orientation. But the research is really lacking to support the effectiveness of this. And we know because we know how important the therapeutic relationship is. And with treatment planning being collaborative, really that's going to be a very more important factor than matching. So thinking about why the therapeutic relationship is even more important with this population, I think it's because they're often resistant to seeking services. There's a lot of shame, belief that treatment won't work, denial. They've often been wrestling with that process of accepting, yes, I have a problem, I can't fix this on my own. Clients are often working through that before they're seeking services, or they're being mandated to seek services and they're not even in that spot of being able to maybe accept something that's out of their control, or accept the disease aspect of their addiction. So, and also as clinicians, we're trying to elicit change. To be a change agent, we need client buy-in. And so the assessment with this population, thinking of it as it may be their first contact in the mental health field, seeking treatment for a disease that they've possibly struggled with for years, it needs to be a positive experience, or they may not return. And that could be the difference between life and death for someone. So it is incredibly important to think about how you're connecting and working to establish a therapeutic relationship with this population. It takes a lot of courage to admit they have a problem. And we all know that there's a lot of negative stigma attached to it. So this is just a visual to show some of the different recommended dimensions of addiction assessment as they relate to different levels of care. So you can see the 6 dimensions. There's kind of like the physical piece. So if someone's coming into a hospital setting, for example, the medical team is assessing where they are at physically with their disease. We want to look at readiness to change. We're looking at, their living environment, but you're assessing across those 6 dimensions. And then that's what you use to work towards determining level of care. And here are some of the examples of levels of care. So, outpatient, intensive outpatient, partial hospitalization, residential, or inpatient. So again, this is just showing how thorough of an assessment is needed with this population and how that, is important in terms of determining level of care. So thank you for listening to my YouTube on assessment and treatment planning when working with those suffering from addictive behaviors.